welcome back to my YouTube channel. Welcome back to Mirror Interpretation to Global. We are creating a video. This is a consent form for vaccination, and I got this one. It's European. The reason why I want to share this one is because they're slightly different from the one that we saw. We saw one for Walmart. You can click on the first video. Then we have a screening questionnaire and consent form for COVID. Then we had the antigen testing form, which is it's for school or traveling and so on. And then we're talking about vaccination consent form, okay, 2021, and this is Rhode Island consent form. The form is classical. If you do it on the phone, will be similar to the one that we already discussed previously. So names, date of birth, male, female, address of the patient, email address, and some of them ask for the primary care provider, some don't. Screening for vaccination eligibility. Some of them do have it in one form. Some of them have it separately, but they do have this questionnaire with yes or no. Are you pregnant and are you breastfeeding? Have you had severe allergic reaction, for example, anaphylaxis, trouble breathing, to any vaccine or injectable therapy, or history of anaphylaxis due to any cause? Anaphylaxis crisis is when your throat is blocked by when you have such a severe reaction that you're so swollen, or for some reason your throat is like blocked and you cannot breathe. I had this, and it's a terrible situation to be in. Have you had a severe allergic reaction, trouble breathing, to component of COVID-19 vaccine, including lipid nanoparticles or polyethylene glycol, PEG? Have you received convalescent plasma, which mean regular plasma or like monoclonal antibody infusions for COVID within the last 90 days. Okay, which mean have you had any blood transfusion or any antibody infusions for COVID or any other reasons in the past 3 months? Are you under age of 12? Are you currently sick? For example, are you currently experiencing fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body ache, and in some of this form is vomiting, diarrhea, pain in the bones, or any body ache or muscle ache as well? Do you have bleeding disorder, or have you or do you take blood thinners? Have you tested positive for COVID in the last 10 days? Are you currently in quarantine for COVID exposure? Have you been diagnosed with multisystem inflammatory syndrome in adults or children in the past 90 days? And if yes, these questions is consult physician prior to receiving the vaccine. If this is your second dose, when was the first administered dose? And if this is your second dose, which vaccine have you received? Pfizer, Moderna, and Johnson & Johnson, and the other one that may be in this form, because they are different, right? And consent for vaccination. I have reviewed my answer to these questions with the vaccinator or the pharmacist or the doctors. If I experience any reaction after leaving, I will notify my primary care provider and doctor. I have reviewed the emergency use authorization fact sheet provided to me today. I understand the benefits and the risk of the vaccine, and I understand that I can review a notice of privacy practice at the time of the vaccination. Privacy is if you allow somebody to have your result, like your doctor. By signing this form, I give permission for a vaccine to be administered to the person above, which is the name on the form, and the record of the vaccination to be entered into the adult immunization registry, which could be state or adult. You see in the New York for care coordination or monitor statewide vaccination coverage, just to see how many people receive it and not, right? For more information about it, I can go to this website, the rhodeisland.gov. Okay. I agree for the information above is correct, and the patient's signature, and then they give for administrative use, they give some of this form include the vaccine, date of the vaccination, manufacturer, lot number, and who vaccinate the person. And that's about the consent form in Rhode Island, which is more similar to what they do in Europe. I hope I answered your question. To the person that was to my live, these 4 videos were COVID consent, Walmart consent, registration for antigen test. This type of calls will be normal, regular to you for medical interpreters. Thank you guys for being here. Thank you for liking, sharing, subscribing. Write me a comment below and have a good day. Bye-bye.